This is the Truth Morning Devotion. My name is Amadou Lamwanaba. We can talk about drug abuse and kush. We can talk about that in the program this morning. But before that, let me listen to President Bio. We've been to talk to Sierra Leoneans in the diaspora about kush, about the drug situation and the country, what in government they do, the challenges and the support that they provide to then guy they were making called victim to rehabilitation. Let me listen to that.
Drugs is a problem everywhere in the world, but we are more concerned about ours. There are so many aspects to it. Those who bring it, those who distribute it, the one the way they take part in them. So we have a whole task force for this, where they deal with all the aspects from enforcement to the treatment. We get the whole center, so we don't treat the one that. Somebody was saying, somebody goes to school, don't graduate. After 6 months, the shoe don't begin playing, they walk by, they play home. Yeah. We all have different psychological makeup them. They feel tired and then just go slip into that kind of thing. That is happening to a lot of our young people. And we are picking them up. In fact, there was one that came from the UK. They took him to Ghana. It did not work. They brought him to Freetown. In Mamasa Satan confessed. After the guy became one of those who was teaching now about that. It's a very complex problem. Drugs, anything with money, is difficult. People will do anything. You see what is happening. Pathway, they don't begin bombing us or what. They will do anything to get it in. People are making billions out of it. And so it is a tough fight. We continue to, the instruments we have, say, police, we have good ones, we have bad ones. They try to do their part. And then, we had huge cash the way we captured through the port, through the airport. We were born. That they go on virtually air all the time. It's happening.
Picking them they die, do ya we they beg the mommy and the guy, cause now we wanna sell them go buy, this crucial deadly. So, with all due respect, I'm not talk waiting, you don't know. Who say you they way life, they give me on the lolo. Don't they do music more than half a decade ago? Say now man them no blow. Your speech was nonsensicality. Excuse me French. Me not so non-entity, but still in a trench. Just one escape reality. Eventuality, no matter the quantity, the dust not the quench. Now I no get nothing when I'm me own. For Kusha don't sell me asset, sell me phone. Where the feeling can camper me, in all the pamper me. So pass a goodie for ton clean salon. Watermelon not so punky. 2 weeks ago now, so then tie me like a monkey. Cause the addiction can control me like a conky. This thing no idol man don't know say me na junkie. Don't fever zombie. This thing evil, this thing a devil. It don't deteriorate me to a whole other level. Not so this man didn't expect, man don't lose me respect. Now the people they look me like rebel. Sam the kush, don't ambog me area. Sam the kush, don't ambog me career. A small bush, don't turn on that in ya. All man they push, where you pass na area. What are they try? Myself no one die, I start full eye. Not on me body, this I just a dry. If I say I know I left, I'm a de lie. We mama them they cry. Way them they watch them picking them they die. Not so una said we not deny. But now we una sell and we they buy.
Welcome back. This is the Truth Morning Devotion on Truth Media. We're on Facebook, we're on YouTube. Welcoming all we viewers them from across the country and across the world. They can talk about You know, this week, like I say, we don't dedicate time to talking about drug abuse, mental health, and waiting to be with your role as a people. You know, waiting with the time for doing for create awareness that we get the situation, and now we get for solve more. Somebody no come other side can help we. Now we really need for accept and agree say this is a problem, and we need for do it right for solve them. So this morning I get the pleasure for welcoming at the studios Ibrahim Samuel Dugba, Director Drug Prevention Education and Training National Drug Law Enforcement Agency. Ibrahim, good morning and welcome.
Good morning, Lamrana. Good morning, viewers.
It is a pleasure having you. I also get with me this morning Dr. Carol Labor. Remember, I've been talking to Dr. Labor when we start this program, you know. She was one of our first guests, and they get the pleasure for get the studio today. In a senior advisor on mental health, Ministry of Health, and technical lead, mental health secretariat at the National Public Health Agency, NPHA. Good morning, Dr. Labor, and welcome.
Good morning, Lamar. Good morning, viewers.
Yeah, it is a pleasure having you,
Thank you.
in the studio. Dugba, they start with you, you know. So waiting with the ask is, in this drug issue we will talk about, I always on the point to the Liberia Drug Enforcement Agency. I can show them, I can show people them. Most times when they arrest people them, they show them out, and then can arrest alone people them. I can see within they say the other time the boss they blame we say now they allow the drugs to go inside the country. But I'm sure it's the same, almost the same agencies. But waiting now the role of and the mandate of the National Drug Law Enforcement Agency as we get this conversation on the drug crisis we face with presently in Salon.
Okay. Lamrana, thank you very much because I know see the truth media who do so. It's not about waiting they can't say no more. It's about being honest to Sierra Leoneans. And in your way for fight, this fight, na in this way for a key platform. First, I want to start with recognizing the fact see there is a drug problem. And drug problem in Sierra Leone, not just Sierra Leone, is a global problem. So the National Drug Law Enforcement Agency gets a mission, gets a vision before we come to the mandate. The vision of the National Drug Law Enforcement Agency now for ensure say this agency makes Sierra Leone a healthy, free nation from drug or harm causes of drug-related abuse to the citizens or people living in Sierra Leone. When you come to the mission statement, it tells you now for coordinate national, sub-regional, regional, and international multi-agency strategy. And this multi-agency strategy now for increased public awareness, education, research, treatment, and rehabilitation of drug victims. So this is a very broad spectrum. And going back to waiting the mandates they say, one of the very important mandates now for ensure say the agency provide leadership in coordinating all issues relating to drug control, eradicating drug abuse and primary causes of drug abuse and illicit drug trafficking. That are the primary function. And another main function now for ensure say we coordinate with other law enforcement agencies, the police, the military, NRA, all security sector we concern for ensure say we collaborate with them.
So how una don't they do this work? Waiting don't be una intervention. You clearly agree say we have a crisis, we have a situation presently in the country. We only see them voice them around. We don't really report them, international media, local media, about the drug situation at Saloon. Waiting don't be the intervention of the National Drug Law Enforcement Agency in this.
So before now, the agency be done the work, but make a take out from 2023 since the coming in of Chief Andrew Kai as the executive director. In the history of the agency, we don't get policy people, we don't get diplomatic people, but Chief Andrew Kai in tenure, where a day as the executive director, bring a lot of transformation. The first thing was Before you see all them videos there, they go around now. Now, the first person will take over in October 2023 for ensure say we go to almost all communities, not to just slum where they feel say now they drug more visible, but other communities. We identify over 50 hotspot communities. We almost visited all, not to just inside Freetown, within the provinces as well, where we ensure say we make them told and they before we begin to see other people then concerned for begin to go out for they get videos of them victims. And then the agency don't be proactive enough. We get a strategic master plan. This strategic master plan don't be developed way back in 2023 to 2028. And this strategic master plan go through parliament and get cabinet conclusion and recommendations. Where it be say, before we begin to get this serious surge in 2024, the 2023 strategic master plan don't be prepared. And that cabinet conclusion be giving one of the key advice say, make we able for include other institutions then will not be there on board inside the strategic plan. Because the strategic plan get time frame for monitoring, for make sure say we able evaluate usa we don't come out and usa we dey go. And it based on 4 main key pillars.
What are them pillars?
The one pillar na capacity building. Number 2 pillar, when a pillar 2, they talk about drug demand reduction and social reintegration. Pillar 3, they talk about law enforcement. And pillar 4, they talk about monitoring evaluation.
So, which one specifically una don't they implement? Because the name of the agency itself, Law Enforcement Agency. Somebody they read the act this morning, we give una power to the Office of the Attorney General for enforce some laws them.
Yeah.
And we don't dey talk now this program about cutting the supply chain, about going into communities, with law enforcement, arresting those very responsible. How much don't they implement that aspect of the agency in mandate and role?
Okay, so now 2 aspects of that mandates we know they almost they get. We get what you call the demand reduction and the supply restriction. The supply restriction, now the enforcement they come in. The demand reduction, now they will do sensitization, prevention, education, awareness, and all of these things. So when it comes in terms of supply restriction, I will give statistics of 2024, 2025, arrests and seizures. You understand? So we mandate limited to prosecution. Where you don't arrest, you prosecute. And we, through the powers we'll get, and we not get the capacity in terms of staffing for law, we the prosecute we matters them. So we go through the TOCU framework and then prosecute on the advice of the DPP. And once that does be made, you understand, what we they do now for observe the proceedings within the courts.
So where una arrest, una they hand over to police?
Not well, not through we they go through the TOCU framework. Because
how did they work? How
the TOCU framework a security framework where don't be set up comprising of different security architecture. And inside this TOCU framework, now they do with prosecution, that meaning like MK Ali where they TOCU as head of TOCU, they process the investigation we go down start and then go continue with that investigation and give a file number and wait for the directive from the DPP with respect to prosecution.
So what's in the cases them? And you say you not get statistics from 2024 to now. What's in the cases them who don't say arrest? Because the point is, if you arrest in the supply chain, indications will be the number they reduce. Because if the people them where they sell, then they arrest them, prosecute them, carry them, go court, and definitely reduction good day.
So,
But what's in the statistics on that?
so wetin people need for understand in the first case, and the fact say drugs not only like where we get the pharmacy board, wherein people register for coming with harmful substances. These are always people where they do criminal mentality, and maybe they get some their own connections. So even with respect to systems, they try to break the system.
Illegal business.
So, and not forget, say, drug business, they are among the 3 world organized crimes. We talk about drug trafficking, ammunition trafficking, and human trafficking. These are the world top 3 organized crimes. So, because of it's an organized crime, you get to look deeper into which kind of nature that particular thing they do. Last year, we get 465 arrests. We not to just arrest, to arrest and prosecution. And these 465 arrests, 372 na male, 93 na female. And waiting na the most types of drugs then. We get cannabis, we will be 83 cases on that alone. Cocaine, 24 cases of that alone. Heroin, 5 cases. 5 cases. Then we get the new psychoactive substances. Kush not a drug will be there under we schedules of drugs then. And Kush, when we look at the case definition at the earlier start of this task force, we can for understand say Kush na a composition of different chemicals where they form these highly synthetic components. And the Sierra Leone Kush is different from maybe how you they compare other Kush them around the world. Anything can be used from a Kush. Initially, we be no say na marshmallow. When we get GI talks, when at the global initiative on trans-organized crime, where they can do the survey studies in Sierra Leone, where we collect 93 samples of drugs cut across the country, including the one where they seize na Wataki, where be they in custody na Toku. We can for understand say the FTIR spectrometer testing tool where they use. It will say 93% of the substance we found in Wikush na nitrizine. And nitrizine is 100 times potent than fentanyl. Where it means say nitrizine na chemicals were produced right in the 1950s in the laboratories in America. The nitrizine developed legs by itself and common America cancer alone, or be found in them marshmallows them. But security stiffness in the area of supply restriction make people stop for imports marshmallow. So they result into now using local chemicals. And most of some of them chemicals are will be the active chemicals them. Now they you man where you talk about we say you talk to in England, they notice say that they can because these are active chemicals and where they buy through internet and ship into Sierra Leone through DHL. Evidence they inside the reports where the people and get the findings say most of these things they come off from then Korea importations them. They implicate other things them, but we not going to go into the details and they because we as a country not going to build on the evidence and the way they produce.
So with the arrest there, within National Drug Law Enforcement Agency could say, are the numbers going down? Or we get a situation whose side it's being produced internally now and the network of users don't they increase? Because that's what we see in the streets.
So,
seeing the young people there. Yesterday, the other day I get 2 guys and they were talking about not just Kush, they talk about Tramadol and how they call the other one. You know, that one is that called.
So the drugs and they plenty. Now make what we dey focus on kush normal, Lord not forget say. So we at the agency, we know they look at a normal say na kush na the troublesome drug. There are lots of other drugs that we dey cause havoc. Tramadol we dey see, so now we don't even meant to understand we arrest few tramadols when a 500 milligram. Could you imagine that? 500 milligram. The 250 milligram where you test them under the forensic analysis, the way to say forensic test, they tell you about 800 and something milligram. So the 225, you understand, not just like a cover up, like what they say brand.
So not a 225
Not
like
a
how they
two-
look, and 500.
So 225,
Now the 225.
that 225 milligram,
Yeah.
in actual forensic content is about 800 something milligram.
One guy sit on and they tell me say they take 10 of Randy per day.
Jaden,
Yes.
you ask Jaden. Jaden are one of the few people who go through the rehabilitation. Now, I'm so proud of him because himself they campaign and now one of the very strong activists then right now in his own vision now for see how for end tramadol.
Yeah, yeah.
And I like in your part now mainly tramadol. You know say other drugs and the way they destroy you, but it don't be touched, destroyed by tramadol.
They say they take ecstasy as well for sex here in partner.
So these are some of the problem. Let alone make some of them games there we they make like say we don't understand. Sierra Leone is a very sexually attractive nation. 80% of the youth man or pardon where they take tramadol or any other drug now for enhanced and sexual potence. Waiting, Dr. Carol, they are the show for you like that. So.
We're educating the public. That's
You know,
the idea of this.
The truth is, it will surprise you for let you know how people don't try for destroy themselves because they want to please their partners, both male and female. The woman the way they go into drugs, either now the boyfriend they introduce them to them, or some of the young boys the way they go into drugs, they don't meet up girlfriend where they take ecstasy. You understand? So now you don't introduce her into the drugs. So it did both ways. And one thing who they fail to realize, or we make you always they tell people, may you two not even save.
Yeah,
For say we not go be drug victims.
yeah.
And I like when His Excellency, before the declaration of the state of public health emergency, be careful, look first into the Kush crisis and say, okay, Lord be magnanimous small. Because the Act, the NDC Act, Part 3 of the NDC Act states, say, when you are found in possession of a contraband substance, you'll be convicted to not less than 5 years imprisonment. So if you find out the prisons and other correctional facilities don't become overcrowded
With cases.
with drug victims. So
Yeah, yeah,
we
the
can't
one
begin
there.
to look at and now say, okay, waiting for B we approach. We approach now for B, let we begin to visit the correctional service and begin to look out for the one that when are victims and the one that when are perpetrators.
Yeah.
So within that verge, unfortunately, now begets the prison break.
Yeah, where a lot of come out.
Yes.
Well, they come to you back shortly, Dugba. Let me come to Dr. Carol Libor. You know, the picture where this man don't paint, I dey imagine the risk we're sitting on. We're about for celebrate World Mental Health Day and we can get conversation around talk about match pass, celebrate, and we're done with it.
Yes.
What's in our situation with the relationship between drug abuse and mental health issues in this country?
Thank you, Lamra, for your question. English or Creole?
Creole. I know you can knack the Creole as well.
Okay. So the challenge where, from me own lens, where I see we they conflate boku things then. Like we just they box up, mix up a lot of things that way they go on. So when we they talk about addiction, I be they listen to Dugba. we get for understand as a society, say addiction, not so somebody just go say, hey, la go smoke, la drink, la take ecstasy. Addiction is a brain disease. It's a disease of the brain. And I always like to go backwards because anything where they go, we get for go before, you get for look behind, you get for look under the root cause. So if you do a root cause analysis of the issues there, if you look at the age group of the youth that using drugs, so I know just contain onto kush, or even youth that have mental health challenges, they were born either before, during, or after the Civil War, right? And so they have been born into a traumatic situation. Trauma don't impact their development cycle, the normal stages of development, brain development. So if you say 0 to 10, that age they were picking just born, out there for the grow, begin creep, begin waka. Then youth they now then born war. The mama and papa they're exposed to war. So that is something they call attachment theory. For letting able attach to the mama then, attach to the papa then, and grow in a normal, healthy society. They were robbed of dande. They're not get dande. So then they grow up now with an addicted brain in terms of, a traumatic brain, and then you bring in addiction now. So you have something that's called the biopsychosocial model, right? And so that's the biological factors. And I talk back to trauma. I'm a big proponent of educating individuals on trauma. Woman go get belly. Let me go back to the one now. Woman go get belly. What don't begin? Any trauma where that woman don't be exposed to, whether not from sexual gender-based violence, whether it's from the war, whether it's poverty, hunger, food insecurity, you name it, various societal factors, then they impacting picking where you not born it. If not girl picking now, where girl picking born, they don't born out with all in reproductive eggs, where you get for born ion picking now. So ion picking and yet unborn has been exposed to trauma. So let me come back down to addiction and mental health. You get the psychological factors. Some people, youth today, they may be genetically predisposed to addiction. That means saying, don't they line their DNA. Addiction, they not in blood. Just like how you go born picking, you possibly go say, oh, this picking, if you by mama, if you by papa. That's the external features. But if you look internally, their DNA, the traits where they, so it's addiction, they even sexual violence, gender-based violence, sexual violence, different things that they were picking.
So not only outward,
right,
but internally as well, they
Yes.
get the traits.
Yes, so it's a footprint, your DNA. So genetic predisposition. So now you go get somebody, you go say, Allah, just take ecstasy, just like how Dugba say, Allah, take on one time. Then they're addicted. Somebody go say, la, take kush, la, just try them. Stress me, man, try this thing. Then they're addicted. So substance abuse is can be categorized as a mental health condition. They have what is called MNS, which is mental, neurological, and substance use conditions under WHO. And so when you look at individuals that are using, because not all man where they use are addicted. Some people use for pleasure. So a lot of focus, they focus on the youth that where they see. But they see the people that where they take kush, then go to office, then they walk. They see and people that where they drink all nets, smoke jamba all nets, then go to office, then they walk. So there's a lot to unpack when we talk about addiction and mental health in we society.
The exposure to them drugs there, the tramadol way they talk about the ecstasy and addiction, how is it exposing with society as well to mental health issues?
I would say anything that you overuse that has psychoactive reactions of the brain can cause addiction. So look, let's use tramadol for an example. Tramadol is a painkiller. Then they use them. I have migraine headaches. I'm prescribed tramadol. If I use amboku, then it'll cause the effects that you see from youth. So there's a very thin line in waiting with the holding youth, I'm not going to say picking a youth they're responsible to, then we as the adults now in society. Just before I come, I read one text message and somebody say, oh, now the pharmacy them, people them, then they sell tramadol, then they sell these, governments, no, they do nothing. I said, we have a whole pharmacy board. You know, Dugba talked about the task force for drug and substance use. Various components, various pillars on the task force. Because not all man they do all thing. One person not going able to do one thing. So again, the correlation between addiction and mental health is there. Someone can be addicted and now they develop depression, or someone can be suffer from depression and now start to take kush as a maladaptive coping mechanism. Means they want just dull the pain or the experience or the stress within they go through. You know, Lamara, some people then can say, oh, nah, government, nah, society, nah, this. I'll take America as an example. Because, yeah, you make accents. In America, of course, I was born here, but in America, I grew over 40 plus years in America. America, even around the world, you have millionaires that are overdosing on drugs, cocaine, kush. So we can't always associate it with a socioeconomical factor. Yes, socioeconomics has a large role to play in anything where they happen in our society. It increases the risk factors where if somebody to go say then they go take kush, because when we talk about mental health and well-being, there's various factors, social factors, family factors, various environmental factors that can all place someone at risk. I talked about the biopsychosocial factors as well. And so it's really incumbent on we as a society, for one, educate the public as a whole within our addiction. And then two, you get people them where they go seek treatment at the Sierra Leone Psychiatric Hospital, formerly known as the Kissy Hospital. And last year, there was a few thousand, I have the stats, when we go to break out, get the actual statistics, that sought treatment. As a society, we therefore encourage people then for go seek treatment, whether or not the psychiatric hospital, whether or not the rehabilitation centers, where the Ministry of Social Welfare they run, the National Public Health Agencies, all man, do by the NDLA, all man they join hand for create these rehabilitation structures.
Doc, how do we not conflict addiction and mental health? Because, you know, we get the psychiatric hospital, we get the rehab centers there.
Yes.
People can say a spiritual problem back. You know, people and get people who are on addiction and can take them, carry them go church, carry them go mosque, pray for them.
Yes.
No, they carry them go to mental or the rehab center. But how do we differentiate addiction where somebody don't dey into, where they go carry and go to the rehab center for, you know, rehabilitate them, and mental health where somebody don't get this mental problem, maybe two because they take drugs and go to the psychiatric home?
No, I'm not going to say we go, I don't think so we for separate them, because like I say, it is mental, neurological, and substance use conditions, MNS. So the three are lumped in their group. But you're not going to say if somebody they exhibit signs and symptoms of depression, you can go to the rehabilitation center. Again, we get for educate people and also within the signs and symptoms. We have a lot of cultural beliefs, cultural influences on addiction and mental health, where people go say, oh, na witchcraft, na juju, na sweat and swam, you go keep on posting man, this, that, they don't do We have to separate the cultural context, beliefs of addiction, mental health, and then know where to take, know where to refer. Currently, we try for build up the referral pathways, outside the people then for go. Because as you say, if an addiction, they can go to the Kissy Hospital, they can go to the Ministry of Social Welfare for assessment. Even if they have signs of mental health conditions, I don't like for use the word disorder, because disorder just means that it's akin to something do passing. And so if we want to break the stigma, we need to shift away from these harmful words. You can take them anywhere, even if somebody gets signs and symptoms of not depression, not addiction, you can take them to ministry, then do the assessment. They have social workers, they're clinical social workers, I believe. They'll do the assessment and say, the rehabilitation center, they don't meet the criteria. Let them go to Kisi Hospital. Where you talk about the community approach, where people then they go get this person and say, me not counselor, me not therapist, me not addictions, me not this, me not that. Wait till we get for do, and I they preach this all the time. Sometimes people don't get vexed by myself. We need to have a whole of government approach in training and certifying people. Just like Dugba say, the tours where they may get, where they go in different community. I went on a few. Wait till me see, you go cry. Somebody said they have a rehabilitation center. Naimpala. He chained people there. You can't do that.
And that is happening.
Yes, and
People
you
have
can't.
private rehabs.
And yes, go ahead. And these private rehabilitation centers, if not private rehabilitation center, would I give you license for open? Would they monitor you? Where's the accountability aspect? If you say you have a private rehabilitation center, it's good. We need them. We need as many people as we can. But let's do it the correct way. If you have a private rehabilitation center, do you have a service level agreement with either the Ministry of Health, Ministry of Social Welfare, whoever is the line ministry? Has your place been assessed? Is it fit for purpose? Do you keep records of who's coming in? If somebody comes to you and say, this person get kush, you know? Who's doing the clinical assessment of these individuals to see if it's addiction, see what the addiction is, right? And then also see if it's addiction because you have what's called comorbid. You can have two or more issues going on. So if you say you have a rehabilitation center or you're not a counselor, or somebody come to you, how you they assess them? What do they treat them for? Where's your records? What evidence-based intervention are you using? For just go sit down, talk to people, that's a good thing. But if you want to talk about addiction and recovery, there's something called neuroplasticity, right? Which means individuals, the brain is relearning. They have to learn how to control their urges. Because once you have an addicted brain, even if you take a scan of the brain, addiction is, you can see it on a CAT scan. The matters of the brain. Yes, you can see it. And so now, if the brain are like, wait, I'm going to catch you.
Yeah.
I'm going to catch you.
Tell you.
Yes. Your brain, they say, buddy man, let me go smoke. $10 each. $10 each.
Yeah.
So when you're going through recovery now, neuroplasticity, it's teaching you skills. Say, no, not to that. They have what is called DBT, dialectical behavior skills, cognitive behavior skills, all these things that we can teach, we can accredit organizations to do this work because we need it. But you have so many that are doing it. And again, it's something that's needed. So I know they condone nobody. Let nobody know rights but me.
Say they condemn them. Yes, we understand. You're not condemning.
Yes, I'm not
I
condemning.
agree with you because
Yes.
so I don't see pictures of people put them in chains.
Yes.
Then sit them at them place and I think waiting in the time for the perhaps it's restriction. Restricting them from going out and outside and day and they then go give them food, na chain them go move, go use the toilet, no more than they go any side. And I agree with you. There need to be proper process. Get professionals and we could certify, say, yes, this is what you do. Because now the North we understand, say, rehabilitation center not the day. In Kenema, there's a guy I spoke to yesterday, one Dr. Stevens, we say he only provide a space, he help with rehabilitation.
Okay.
Somebody reached out to me yesterday, we say he's trying to open one in Port Loco as well, because the cases them plenty there as well. But as well, how side governments will come in? How government will come in for work with them people there as much as in the try for provide the service, outside government able to provide them.
So governments are coming. At the National Public Health Agency, I know they speak for them because I'm not the spokesperson for that, but they work with the communities that are building rehabilitation centers to ensure that they're fit for purpose. So anybody way one, open one, they can reach out to me through you, and I can give them the proper channels. They should have, I just talked about it, service level agreements,
Agreements, yeah.
SLAs, and if it's a professional, so you have allied professional, like is it the commissioner council that can see who's doing this work? There has to be accountability, because one of the first premises when you talk about addiction and mental health treatment is do no harm. Let we know complex people, then let we not do harm to them. So if you say they chain people, then training is against the law. It's against, just universal best practices. When you confine them to a space, then you're really forcing them to go through dehydration, what's in the call stuff? Detoxification, yes. Detoxification, which is good. Detoxification, they pull all the toxins out the body, and you go see some people that when they go through detox, then go fall ill. Sometimes people then they sick bad go through because they're going through withdrawal. The body they crave the drug now. So if you deprive anybody of anything, after a certain time, then go say, okay, if you not feed me today, Angie go catch me. By next week, if you not feed me, I go say, I not say you not feed me. So the brain get way for protect we.
Quickly before we come to Dugbabak, I just want to ask you, what's in the signs them where somebody for look for, say somebody they, we for be concerned with him mental health status, how somebody for behave, where somebody for be suspicious or say they will seek medical help.
So there's not one sign and symptom. There's various classification of MNS, mental, neurological, and substance use. Even when it comes to depression, not so just depression. You have bipolar depression. You can have Bele Uman that has postpartum depression. You can have psychoactive depression, which is drug-induced depression. And so it takes education from professionals like where we go train or educate to do psychoeducation, let people that know signs and symptoms. But generally, when you have behavioral shifts, changes not posting behavior, changes not in normal patterns, like if they don't use for sleep 8 hours, but now they sleep all day. If they're used for go walk now, you have absenteeism in the workplace. Because again, you have what's called functional addiction. People then they can be addicts, but yes, or be addicted, but yes, grab, go walk. So there's various signs and symptoms, but those behavioral changes are what you look for. If they eat small, now they want to eat boku. So then they don't begin to take a drug, where now they induce more hunger upon them. So the issues are many. The issues are many, and I really believe we have to build an ecosystem around this issue. Because if we just say, kotia, putia, this they do this, then we'll continue to have these issues. But I would say, where people then can say, I can hear 90% of youth are on drugs. So anytime somebody tell me that, they ask, who's how you pull your statistics? Who's how you pull your statistics? Most of the youth are on drugs. Who's how you get your data? Because according to the 2024 data, individuals that sought treatment, now the hospitals around the country, is less than 10,000. And that's in totality, mental, neurological
There's a statistics.
addictions.
I have it.
Yeah.
I will give it to you.
So when it comes to these community centers, if they're not registered with the government or an agency, and we don't have the reporting data, how can we say you're treating 1,000 people a year? It's impossible. So that we have to build the system for them to report. And with that, I know you want to shift to Dubai. Friday is World Mental Health Day. The office that I lead, the Mental Health Secretariat, we're launching. We can use this first ever. But we're launching the first national mental health and psychosocial support, which is MHPSS. Provider program guidelines. Just like for them people if they do this work,
Yeah.
Can't let we train una. Can't let you register. Let we see say you don't register with the ministry, with NDLA, social welfare. Then now we go help support you.
Okay.
Do capacity building, which is part of we mandate.
Yeah, and then I've been really want to ask, how do people seek help as well? Even the public, how do they, if we get a family member and they behave this way, how do we seek help from the professionals, especially in a society who say somebody go privacy, go to church or mosque for slow go pray over this person, a spiritual problem, than actually talking to somebody like una, we go provide the actual help for help this person.
So I would say, again, you have the Kissy Hospital, you have the social welfare, because they have social workers that provide counseling as well. And then also what we're trying to build under my office is the MHPSS system, integrating it in emergencies. There's a resolution we've been passed, 2024 World Health Assembly, MHPSS before, during, and after emergencies, crisis, epidemics, things of that nature. This Kush is a crisis. It's an emergency. It was declared a public health emergency by His Excellency, the President, Dr. Julius Matabio. So in terms of that, we are doing capacity building. Our mandate is to train 5,000 people in 5 years. Last year, we were able to exceed that. We were able to train and build capacity 1,090 multi-sectoral individuals. And so some of them are healthcare workers, some of them are frontline workers, some of them are emergency responders. So what do? We don't create a database of all these individuals that we have. We want to eventually have a roster where we can call on people for go app. But all of that, it takes time, it takes investments, and to be very honest, mental health is not one.
It's not a priority.
No, I'm not. It is a priority, and I would say it's a priority because I was appointed. I'm the first person appointed by a sitting president to address mental health issues. It's a priority. Mental health is not a funding priority. That's what the word I'm looking for is not a funding priority for global partners. Just last week at UNGA, the UN General Assembly, there was a declaration made on mental health, and really using a public health approach, health promotion, and well-being. However, until there's a global push for funding, it's going to be very difficult for us because not to all things governments go able to do. We are all doing our best, but even with that, we need partners to come in that can help us build these ecosystems that we need. And these are ecosystems at the community level. Because if you talk about addiction, and in situations that where mental health professionals not boku, you get for focus on prevention and early interventions. And I don't me office they focus on. We know you do clinical work, we know they diagnose. Focus on prevention and early intervention. What's in that prevention? You educate the community, you educate at large on the harms of addiction, signs to watch for, and then also referral pathways and counseling. You can sit down with your family, you counsel them, we can build the capacity of the community. So if you bring me back like this, every now and then, we can sit down,
we are committed to this. If we can, if the office will develop PSAs, public service announcements, and messages that we can, they put out, even with the morning program, every day we get a message about mental health. It helps the public to understand how for seek help, who say for seek help, waiting at the signs and for look for if somebody then house with you, they behave one kind of way. We all need them. And I could say the time I spoke to you after, I needed to speak out.
Yes.
I had something in me.
Yes.
And I needed to speak out and after that, a lot of things, what I needed was to speak out, to speak to someone. And I poured it out, and it's got better. Sometimes I don't think people need no more.
Yes,
So,
exactly. You need people, because even when you reach out to me, and again, I knew Binta when I worked with her briefly, beautiful, gentle soul. And so when we talk about grief, our society is full of individuals that are grieving. There's something that's called traumatic grief, So people that have experienced trauma, again, I always go back to the word. People go, oh, Dr. Labor, the word you don't pass. No. We have historical trauma that's passed down generation to generation, intergenerational trauma, the traumatic grief. And so the cycle of grief, you know, the last cycle, the last aspect of grief is acceptance. And so if you're holding it in, you haven't released it. You know, it unbug you, but like you say, if you get somebody where you talk to, somebody where they keep your secrets, confidentiality, ethics, these are all the things in the curriculum that we teach, that we've developed, is in. What is confidentiality? What is ethics in mental health? Not to fall, if Dugba can't to me today, or if you, like say, when you reach out to me, I don't tell nobody, say, hey, I'm not coming, I just see they do it. You need confidentiality. Because if you go tell somebody today, you know, I think how they go through. That's why people don't talk. And so even dealing with grief, dealing with stress, how do you manage stress? Because again, mental health, not to just one thing. Mental health works on it operates on a continuum, not like ruler. You know, the ruler get the different lines that you can go from a state of well to unwell. Like we're passing the swim. I go use that analogy there. Passing the swim. Okay, you sabi swim, you dey pantap the water. You're well. Things that don't begin on you, stress don't begin on you. You don't begin go under now. You're entering now the stages of unwell. Where water don't pass guy now, you're not able.
You don't.
Yes. You know, for tread water self, you're not able. So we want to catch the people we don't begin struggle. And when we look at prevention and early intervention. And that's something everyone can do.
Yeah, we all need for play with part.
I want to add, sorry, we do have a risk communications, so I'll put you in touch with them in terms of the messaging.
Sure.
At the NPHA.
Yeah, sure.
With
That's
Patrick and
important.
Harold. Yes.
That's very important.
Awesome.
Duba, you know, Doc talk about something we challenge we almost every sector they face. Global funding in the area there. Like you say, the drug business, na boku money your president have talk. Say people when they make plenty money for it. And so people when they make plenty money, sometimes it become very powerful for even tackle them down. It become problem. What's in the agency they do, you know, in terms of capacity, in terms of mobility, in terms of resources for help fight this fight and doing our work?
So the National Drug Law Enforcement Agency, first and foremost, we need to understand, say, we don't do a lot of things. Back in 2023, we get the opportunity through ECOWAS and government of Sierra Leone for training 25 addiction professionals. These addiction professionals are through ECOWAS funded and the American government, Sierra Leone government for able for train them people there. And that one on substance, we call them UTC, Universal Treatment Curriculum. Na a Colombo plan treatment training where Dr. Carolia know people around the world, they pay lots of money for get that UTC training. Universal Treatment Curriculum for Substance Use Prevention Professionals. So when we get then first set of cohorts there, we do that training, it be timely at the time where we can begin get the serious urge. So then people there be in the different communities, the military, we be get somebody from the correctional service, we can get some high rates of drug use in the correctional service. So we'll be able to get them people there will be recommend, because one of the things for profile solution, one of the solutions for do the assessment that they look at the dependence, the drug dependence assessment. And the drug dependence assessment na able make you able know say, oh, this person are only substance they abuse, or like how Dr. Carol say, he gets a comorbid. So in the treatment program, when you get a substance abuse victim, you for know say If only na substance abuse, then if we go to a substance abuse treatment program. But if you get comorbid, we get comorbid capable and comorbid enhanced. Comorbid capable, now we are in the post, they go through substance abuse, there may be a little bit medical condition or mental health condition, but the mental health or the medical condition not too high, so it don't become a comorbid capable. And the comorbid enhanced, now we are in the post, they go through substance abuse, medical condition, mental health condition. So now I make the Kisi Psychiatric Teaching Hospital, now one of the facility when a comorbid enhanced treatment facility. Because then they take care of mental health, they take care of medical, and they take care of substance abuse.
In terms of collaboration, how una they work with, likely police? Toku, you talk about Toku first. I don't see a lot of reports where police go say we don't arrest this person with drugs and go show him picture and all after that, And then at the law enforcement agency actually then get the capacity and then get the resources and all of that. How now they collaborate and partner with them for do this work?
So Lamrana, the agency, na the lead agency for drug-related activities.
But what you they say, and like na police they do all the work.
So
and then they
before now, the agency no be get certain mandates. Now make we tell you about the regulation, the 2021 regulatory powers, when the powers of the police, full police powers, where it means say NDLA can arrest, can prosecute, can even investigate and charge real matters.
Una get that capacity?
Of course. If you go back to the regulatory powers 2021, you go know say the NDLA don't be given the full police powers.
Yeah, I understand, Andy. What you
understand?
Asked about
So,
the capacity
in terms
for
of
arrest and say get the officers them out there. Like I give example, they did Liberia drug law enforcement. Liberia get police, but then get the Liberia drug enforcement agency. Where you see them, they look like police officers too. Then get some, then they will get gun, some then they get mobility, then they go to communities them, and now then they do the arrest and even carry the cases, then go court.
So you waiting we will always continue for say wherever there are successes there are challenges. So the National Drug Law Enforcement Agency must get its own challenges, and waiting we can always say government business like competing priorities. Government get lot and lot of other issues, so we can always try for lobby with government for make them able prioritize with the agency in mobility and other problems them we will face as challenge. We really no go deviate we say for say we no get challenge. Challenges then they. But amidst the situation, we still they see outside we go collaborate with other government institutions like you say the police. We want go do some arrest, we they make sure say like presently I get over 40 task force members and na Benghazi, that na the Brookfields, OSD headquarters, where BC then they operate on the arrest and destruction of drug supply routes. So we they collaborate. And when they come in terms of collaboration, NDLA always they collaborate with other institutions. We they collaborate with Dr. Carol Leboya with the mental health and psychosocial service pillar for ensure say we self able for provide some capacity to people who need them. The agency recently just don't benefit from another training from ECOWAS when at the UPC, when at the Universal Prevention Curriculum, again for 25 beneficiaries, when I cut across different institutions, including law enforcement institutions there as well, civil society groups. We even go to the extent, forget the traditional leaders. We get interreligious council. Why we they cut across and get all them people there? Now for make we able for widen the scope. Because at the end of the day, prevention is key. Before we begin to go to treatment, if we prevent, we know to go to treatment. And that's not the proactive nature.
Yeah.
Now we dey talk about, say, schools, I hear you interview with the person from
the
Kenema.
schools, yeah.
So we dey look at how can we get a school-based prevention strategy? How can we get a family-based prevention? How can we get a workplace prevention, community prevention? You understand? So like where Dr. Carol be dey talk, mental health now they affect, we can function as drug addicts when people where they work, and then because of the addictive nature where they don't get, they don't pose some mental health condition. You go surprise how you go see you boss can no more money. It means all side pack, then grumpy. When you do anything, he shout.
Then say the office for the check, then flash claim.
So, in fact, some of the policies then they will develop now, some zero tolerance policy in our workplaces, on drugs, on substance abuse, even smoking. Because you got some boss, they smoke past 10 stick cigarettes. Sometimes it gets in flags where it be say, you don't know what's in the content.
No
like, when
points na me
doctors
flask.
say, you don't know.
Yeah, Doc one
This
come
not
in.
coffee and collagen.
Doc one says.
Yeah, I just want to step in two things. Where Dugbadi say they don't train on UTC and now they don't do the other one. These UTC first, eh?
Yes.
Yes, and then now UPC. These are all very important trainings then for build capacity. The challenge is where they train, not so now, anybody where they train on these type of things, the line ministries then don't recognize these trainings as professionals. Dugba and I have this all the time with the people trained on addiction. They're not professionals in terms of the allied health. Not so? Wait.
I think we need for take this
Yes.
maybe too long we get take this.
Yes, so wait. So, yes, we go talk. So, when you talk about health professionals, HRMO, then you have the various health commission, allied health. And so there should be a way where they don't train all these addiction professionals, that they're acknowledged and registered. So people then can say, okay, we have 50 trained addiction specialists. Not to just una don't train, right?
But then go through
But
the health
these
system.
are two
So
people
that
that
you
when
can-
they go through the CCA, when the global GCA, global credentialing
Yes.
accreditation program. So now international exams,
Yeah, but
and
the
then they
point
accredit them.
Yes.
Yeah, but the point you're doctly making that they can be accredited,
You're accredited.
locally as well in Sierra
Yes.
Leone.
So, in fact,
where we need to
what's
work
very
at.
interesting that the fact say the Ministry of Health is fully involved in this training.
That's good.
You understand? Recent one, this one will do so. Over eight health professionals, including 2 representatives from NPHA.
Yes, and it's good.
You understand? So, what me don't understand, now the same thing, Dr. Carol Labor, we get people that will be trained on mental health.
Yes.
But these people there, they still not even recognize them. Even this morning while they came, I read one of the text message them, where one of the posts they say, I think it say, if they recognize them in the mental health space.
Right.
So why they train them as mental health professionals
Yeah.
where the Ministry of Health don't recognize them?
This is what this
You
is the
understand?
advocacy.
They are trained as mental health professionals. And they're supposed, the DHMT employ them and deploy them, now PHUs and PHCs them.
Okay.
Then are the community, in
Well-
fact, when they talk about the biopsychosocial rehabilitation model, one of the things they try for do as an integration process, now for begin to do rehabilitation at community level.
Okay, let the doc respond.
So, for example, I'll use the healthcare workers, community healthcare workers. They're recognized CADR, which I mean, we don't, if you're a community health worker, there's requirements that you have to meet, and there's a oversight body. Even with the mental health individuals that were trained in the ministry, I don't have any mandate over them. But I know you're talking about the mental health nurses.
Yeah,
and I
mental health
believe that they're trying to do the scheme of service. The same thing should happen with these addiction professionals and even with the individuals that we're training, that we're building capacity. So now government can say, okay, in Bambali district, we have 50 trained and certified addiction professionals. Allied health, because there has to be oversight. Right now, everyone's doing trainings. Everyone's doing their trainings. Now, Lamar, if you can't today, if you say, I'm doing addiction, where are you registered? No one's going to stop you. What we're trying to do is not diminish what the people that they do, but have regulations around it for your protection and the protection of the individuals. Because God forbid, if you say they do addictions, they don't train you obayanda, but they don't recognize it in salon. Who do you get for call if something happens to them? You know what I mean? The people that has been trained, and I know they point to you intentionally, but people that have been trained, what's the referral pathways? What's their reporting structure? Who do they give their oversight? Which ministry?
As you mentioned.
Every year, how do they report? How do they keep records? How many people they don't see? If they don't see John, Peter, Harry, what's in a Harry issue? What you don't do for Harry? So record keeping all down there now for build the capacity, not so for diminish waiting people than they do, because every person where they now this fed is important.
So,
Yes.
Lambrana, when you look at the NDC Act, the National Drug Control Act of 2008, even with respect to the regulation here, we talk about, we go part section 40 of the NDC Act. They tell you about the minister will assign somebody as an inspector. And the role of an inspector, now for do the regulatory of then treatment and rehabilitation centers there. It clearly stated now we NDC Act. And the agency done the work around that because some certain and they in a way come up, the proactiveness they show.
They understand
because
yes,
so before now we be done they get them preparation for how we able do the regulations for rehabilitation.
That's great.
But now recently now we see the Ministry of Social Welfare update their way itself with respect to professional social workers now them rehabilitation facilities then. So equally so the regulation process they on we don't with the based on then service users that will be mapped out now the Ministry of Social Welfare now we do that service mapping of service providers. So with the based on that and we get few of them rehab people then they will be say that they provide rehabilitation. Lambrana is very deplorable with waiting Dr. Carroll say. If you go some rehab and see the deplorable condition, maybe you not go Kenema, that Dr. Stevens where did they tell you about? Me don't go to the Kenema rehabilitation. When you go there, you go feel pity, not go want for see that site. Because for them, you see, then stick them, then chunk them. You understand? Now they get where they nail something Panam. Now they put on the foot. Big one, not to chain, no, they're not to chain. But at the storm of the stick there.
Everyone. So you know they move.
You can't.
Wow.
So that is the local way how they make. They not get the chain, but that's the storm thing they way they take. Heavy storm, attach some mental something to the way they just hook na your foot and lock up.
So
like you say, there must be a process for regulating them people there. And the worst thing, they need do that thing for free. They pay.
Parents pay.
Parents they pay. Like that place where they talk so na Kenema. When we go there, me and director Ansu, because we be the go do a pre-study on the Gundama. Is it Gundama? No, Daru Barracks for the proposed rehabilitation for the eastern region. So we be the go do that visibility study. So we get tempted for we go inside that because we go on the way we are that rehabilitation places. So answer this, we make it for go check the man. I shed tears. The videos and we get them videos and we will just document them. You go. When you see the situation, they were overcrowded.
Yeah, and so it's over 500 people.
Presently, they are overcrowded. Yeah. They are not given better medical services. They don't have professional social workers. They don't have a data system for no waiting. In fact, The entry point to a rehabilitation, assessment and screening. You need for know which condition this person they come with.
But that was what
You even
doctors
get for
said.
know the forensic analysis
Of the
is-
mental health system.
No, the forensic analysis. If this person don't become put somebody who don't be a criminal
Amongst
other people, we know to criminal. All of them thing and they within the assessment scope where they look out for.
Doc, this is the situation. You know, it's. I don't see videos them of other places. Some side and they treat people, and some side and say then they beat people and back safe. If you come out, you are escape, then go bring you, can beat you. How do we address this?
So there's two things going on here. You have the rehabilitation centers. I'm not directly involved with the rehabilitation centers. There needs to be regulations on what constitutes a rehabilitation center. One. What's in the qualifications for the people that where they work, where they do intake. Back to the point where they talk about they don't train. The people that we don't train, there should be a database, part of the referral system. Now, that they talk about. If there's a database, if somebody call me today, I can able to tell and say, oh, there's an addiction specialist where NDLA don't train, then they McKinney, then they Bo, then they Pujon. So that's what I'm talking about, and having that oversight,
So
accountability.
even if families in need, they know where
Yes,
to
they
go.
can go. And all of that takes, that's building the ecosystem. You get for build the system to have the database with the referral pathways. Uda send. We don't send this person go see Lama. Lama every year now, you can't tell we. Almost people that you don't see. What do you do for them? Waiting at the condition, waiting at the diagnosis, waiting at the outcomes. So all that it takes, what we're trying to build through my office is the ecosystem of MHPSS.
We're about for commemorate World Mental Health Day. What's in our status as a country with mental health? How you go assess them?
So I would say for this year, the theme is mental health in emergencies, which is what we work on. The guidelines, we get consultants, we don't come, we go support, we strategic plan. One of the good things I would say in terms of our system is we're building it. Yes, I was appointed, but I'm a technical person. I have the expertise. So go see we say we bring person because we have the technical expertise in-house, which is good. The mental health of our society is very challenging to assess. You can only assess something where person come to you and you do a full assessment. But I would say the tempo of the community as a whole, we're very traumatic. We have a lot of traumatic exposure.
I make the vex quick.
Yes. You go see somebody where you the top of vex. If I gonna do now, do but don't put me bottle yonder. Why pull out? What's happened? Then tell me so I saw you turn. You didn't see that then. Now the thing where you pull, no, I guess something inside me. So when we even talk about anger, where people in the anger you see even on social media, cause this standing, trauma plays a big role in the state of our society today. We've established a MHPSS technical working group of many of the MDAs. So we come together now. We're looking at workplace mental health. Because again, our premise is under emergency. So they emergency now. So how do we educate these individuals in the working place? Because now we're able to cascade the messages. So the state of mental health that I would say is we're a traumatized community. We need to increase education, awareness, accessibility, and accountability. We need to build capacity of professionals to address these issues, and that's through accreditation and having an ecosystem around the clinical aspect of it.
We get few comments here, should try for wrap up the conversation. This first one from J Bassi. This is the point the doctor is making. Until you guys fight this drug addiction issue in a holistic manner involving all multiple disciplinary teams, you'll not succeed. We're gonna need medical, nursing, community allied health, and all departments and agencies involved. Abdul Jigad say tramadol na the pharmacy them they bring na the country. We can talk about that and how we dey control some of the drugs in there as well. This other one from Ibrahim Lansana, he says the government of Liberia has commissioned a fleet of brand new vehicles to the Liberia Drug Enforcement Agency. This initiative aims to enhance the agency's operational capacity in combating illicit drug trafficking and abuse across the country. Who is regulating these centers? What credentials do they need to have? Do they have drug health experts? What do they give them when they are doing when they are going through withdrawals? Do they have allied health professionals? Elevated SCBC Kush feds go likely easy for feds, especially with some people where for big Kush victim don't already see waiting, they don't do others. But the way young man them they defend tramadol, I'm afraid. I pray we not lost we focus as youths behind just because we want to get high for a few moments. Someone is saying, doctor is saying the truth. Another one we'll take quickly. It's a mental illness is totally different from addiction. There are a lot of people who use drugs for recreational purposes but still function in the society. People that are addicts, on the other hand, cannot function well. So many agencies on drug enforcement and control, but still youths, then they die. Those agencies are just job creation for, yeah. Yeah, so I'll take one final one. I disagree with this man saying 80% of the man them where they take tramadol now for the sexual urge and Lisa. Boys below age 18, women know we've been they take tramadol, they're not sabi human business. Safe. Thankfully, we were able to distract their attention from it, alhamdulillah, now. And it's not just for sex. There's this one, I think it's important, I read it. It says, I believe the government must take a more robust approach this time by going deep into communities and ensuring the drug supply chain is traced from the roots. It's crystal clear that drug abuse is on the rise and our youth are losing their lives in tragic ways. Now is the time for the task force to take to the streets and tackle this crisis head on. Yes, Doc, somebody they tell I do for you. Minkailo, Minks is watching.
Uncle.
Yes, he's saying hi. And yes, Duba, it starts with you. Yesterday I get the mail now. I talk about, from January to this October, they don't collect over 200 the body them across freedom. And he writes a letter to the Minister of Internal Affairs as well, raising concern and calling for a conversation around this, because most of the cases where people understand are drug-related issues. Apart from that, making drive past Lumley most times. My community now not take Lumley safe. I go back to my communities most times on weekends. I see young people who have been sabi, we've been in school, don't get into drugs, some don't get so food and they struggle and they're around and all of that. Somebody talk about enforcement, the enforcement aspect of the agency. How una they do this work? How do you enforce what the law says and collaborate with the police for address the supply chain?
Okay. Lambrana, make us start with you trend from the mayor. I'm not going to deny the mayor say they know they collect dead bodies in our streets. But they look at the scientific aspects. I know can sit on a radio here and tell you say all of them body they collect, they die of drugs or they die of kush. We dey work with the CME office, the chief medical examiner. Waiting me go scientifically or publicly agree to if the CME, you understand, say the autopsy where they do per them body then the na drug related death, then I go proudly say say the mayor correct say them people and the na drug victims.
Just to clarify, the mayor say sometimes it's difficult the body then can spoil, and sometimes she said even there was a time
different thing they kill
but
person.
she mentioned that. Well, let's just clarify what she said. She said they will do. She was even asking for that. Say them body there, then for able to do autopsy per them and check them because you don't know what's in the kill them. She was just raising concern. Say because some of the people who they call them, she was even sad about it that people then they go call them and tell and say the body there over Kampula like na dirty day, not so like mortal man don't die. And some of the people who go call for reports go say, this and then drug bobo them where they around. You know, she was basing a comment based on that, but she was actually calling for what you're saying. That autopsy and check need for be done and then people there before them bury them.
So that could be the preferred procedure.
Yeah.
Maybe waiting if they call for go be addressed. But honestly, for let me from that agency, the National Drug Law Enforcement Agency, go endorse or say anything which related to then deaths and the for be kush or other drug related, then I believe say except to then kind of procedure.
So again, like clarify, I'm not asking you to say they're drug related, and the mayor not say all not drug related.
Okay.
She actually called for autopsy. She's concerned about it.
Okay.
It don't write to the Minister of Internal Affairs that there's this number of people all together. We need for sit down and talk about them and understand how they go about it. And some of the things that we talk about now, how they go do autopsy on them body there before they bury them for no waiting they kill them.
Okay.
But again, the question I ask is about the drug issue. Me are you then a community?
So now,
they see them around.
of course.
Them, look, them over 5 in alumni, I can count them. They come to my card and they go to other people and cow. They see them and they pray for we. But you just see say them get so food, they're not well. And these are boys with into drugs.
So now, when we start this treatment program, the first thing we don't do now for let we able understand why then so there. And it will surprise you for them know say some of them saw there enough feel say na like na the kush give them the so foods. But because of we don't take drugs,
Underlying conditions.
underlying conditions and go make where you get sore, it not go easy for let it heal. And instead of it heal, it expand. And in return, if they stop for take the drugs and take medication, they see improvements.
Then they will.
But as then they mix the drug and the medication, they know they will. We don't get several of them. They can come in our office. We refer them a corner. We they follow up on them. When they begin see improvement, sometimes when the thing severe, the neighbors, people not able to get sit down around them. Now the time they see say they self they afraid the condition. When they begin go to the hospital, they begin take medication. As they don't see improvements, so they go back into the substance.
Because you're treating the symptoms, not the issue.
Yes,
exactly. That the supply chain, the drugs is available.
Addiction, something where is very severe.
You know,
relapse.
No, Dugba. I want let we move to. I agree. We don't talk a lot about the medical aspect of
yes.
it. One of the responsibility of the agency. Now enforcement.
Enforcement they go on. I don't give statistics of
I understand.
number of
But
arrests.
are we doing enough? Because, like you say,
okay, Lamrena, one thing we go make you know say enforcement they go on. The cost of tramadol or the cost of kush trade and now it don't quite different.
okay,
Because of the arrest, the chase, and the other thing them, you dey find out say the scarcity in the commodity, it don't take place. Now, evidence for sure you say arrests they go on and raids they go on.
we're not satisfied with the level.
We don't satisfy because we need for do more. I no go tell you say I know sit down here tell you say we satisfy because we need for do more. More enforcement need for take place. More places need for be visited. More cartel need for be crack on. More organized groups them need for be cracked on. But how that go happen? It takes me, you, communities, and every other person. Of course, we get the powers. But again, how you go get the information?
No, yeah.
The information line are the most important.
Intelligence.
Of course.
That is what you do.
The intelligence aspect, it go take place. For example, if the NDLA gets, let's say, an allocation, serious one, we will put a price tag, say, like we may have become with the challenge for communities cleaning. You find out say it was cooperative because of waiting. There was a price tag for that kind of competition, and people be they see that they give their communities and the way they win them. So the NDLA will put a price tag, say, we they look out for communities where go give we information, or we'll say a drug-free community. A drug-free community challenge.
That's a smart idea, but unfortunately,
You understand?
we're one of the least funded,
I'm
subvented agencies.
So this is one thing I'm saying. Now we can say we continue for lobby with government, as we say government gets competing priorities, and this now one of the issues we feel say it need the attention of government, because it takes the lives of youths them. Where they down this drain.
Yeah.
So if we talk of that, we ready for provide more and more active steps then
You
for
just
make
mentioned one
relations.
very smart
So
idea.
so if we begin say we carry it a drug-free community challenge, you go find out say the communities that go need them, because at the end of the day, this competition here they crave for certain recreational facilities that the community. You understand?
You know,
they support ideas that the communities.
I get a lot of people who don't call me since we started this. People and they say, we know these people in these communities, but we are scared about with safety and security. If we mention them, people and they don't tell me, say, there is a senior citizen, somebody who have been working at State House with the previous government, he did Sugarloaf. He said, don't write to even the police. They don't reply them. But persistently, don't they continue? They use the media, don't they continue? And police raid na the place recently. So people and they don't they talk to me, then go tell me, but this thing they happen now, but not call me anymore, not say me tell you.
Give me number.
Yeah, well, we'll do that.
Not give me number on air.
Yeah.
But
We'll go
give
give
me number
privately. Yes.
to them
We
people
go
then
give-
they,
but
because
again-
right now one of the things that they even fight for, now follow get a toll-free line. Of course, the 117 under the situation room for the National Task Force is still functional. We are in people that can call and still make complaints with respect to drug. And when once then thing and they reported now the 117 line, the situation room will call the various agencies or institutions where it tag with that responsibility for taking necessary action. Don't forget, under the task force, we responsibility. Now we, the National Drug Law Enforcement Agency, the police and the military, they in terms of the law enforcement. The 5 pillars of the task force, of course, every agency, government, ministries, and departments get their respective roles and role they play.
I think the task force needs for they come out and tell people what they're doing and let people get information like they were. Say, if you don't have community, this is happening, call the number there and make we know. Because when we start this, I'm telling you, I don't get a lot of call and audios, but people are scared. They know the people, God reach in our area force. I don't know how they're notorious with. I don't get a lot of call people in a God region. Go call people a name, say they know these people are involved in this, but please, we're scared. We don't make few reports. You can see them come, they raid, they arrest the people, and they come back in the community, and they're scared about themselves. So I think the task force, it need for come out to the public, do education like could they do so, raise awareness, let people understand where they can complain, and how they go protect them, because it's important. Drug is, maybe mama don't they tell me,
so one
they
thing,
can warn me and advise me.
So one thing will can happen where people they I don't know for other institutions, but for we always don't they keep we informants them secured and protected.
Okay.
Because we don't ever get an informant, we don't give we tips, but particular activity in the community. We don't ever complain, say, I don't get a clash, but I don't get a clash back, say, they don't tell and say, nah.
Okay. So what the number people should call if they get information?
So
now?
like I say,
They then call 111?
they can call the 117.
117.
Or you personally, if they call you,
I can
you
refer them to you.
Refer them to me.
Okay.
The reason why now we get the cyber, which is I no can call me number now.
Yeah, I understand. I understand. You know, yes, Doc one say something.
Yeah,
that's
just
really-
briefly, just to interject, because of course NDLA, then they do their work. But when it comes to addiction as a whole, we get to look at the cycle of addiction. And again, not all Monday on Kush. And even before this Kush crisis, remember we even get the Pampas crisis.
Yeah, I remember. Yeah.
An addictive brain will find a drug. If not cleaner self. If not Tylenol, then get for waiting self, then sniff them. An addictive brain will find a drug. Even like in America at one point, people then they sniff like Clorox, sniff then different things then for get high, because it's really to have a active reaction with the brain. And so I want us to also focus on the need to build a network of professionals, a network of non-clinical professionals that can attack this issue at the community level. Because again, you go do all the different things there for stock, demand, and supply. If the supply go down for one thing, the demand will go up for something else. Yes.
So they say tramadol now in the up right now.
And tramadol is something, again, people then they take them tablets, people then they crush them, and sniff them, people then they put them inside jamba, people then go take any kind leaf, mix the tramadol, then smoke them. And so while they address supply and demand, we have to address addiction as a brain disease. Just like we go say, a person can have them broke their foot. You may not go say, "La help you." I don't like no side, I don't know, but la help you. But if they educate them people they are at the community level, professionals, we understand the addictive disease of the brain. We understand, things like the triune brain, how people are managing their urges, how the parasympathetic nerve is affected by psychoactive drugs, all of that. I think once we build the education system around addiction, we'll be more sympathetic to individuals that are addicted. Because not to for put something down alapande, say no smoke or not do this, you dey bias with family, you dey do this. We have to treat addiction as a disease that it is, and which means we have to have more resources into building capacity. I can tell you we were able to train 1,090 people last year because of support from Global Fund between now. We funded it on December. So we have no funding. We know there's no subventions because, again, it's competing priorities. And who's competing? So these are some of the challenges that we're facing. I was appointed in 2022, Secretariat established in April 2023. Not one single dime. Not one dime.
You Secretariat not receiving
one dime. Now, Global
how
Fund.
How are you running it?
Now, the Global Fund, we had a partner that was partnered with us, but it ends in December. And so when we talk about competing priorities.
But again, this is a question. I know you will not answer this. And
So
talk about
ask
this.
me now, because I don't think
But this is a problem. This is a point again about how, we prioritize addressing this issue. Because
Let interject.
if we set if we set up an office like yours, as important as it is, me not ever know say with all what I've seen you doing and engaging, and I don't ever think say you've not been getting subvention.
I have a personal interest in it.
Yes, exactly. So if you're not somebody who not get personal interest and passion in doing this, you say no, but let me just sit. I don't even need to reach out to Lamran and say, look, can talk about mental health. I don't need to come out and do this,
But I would say at the highest level, to His Excellency's credit, he don't push for the office. Not so you get for come down for say, make sure say una do this. I'm being very honest now, and sometimes people then go vex for me. That part don't talk almost 10. Let so and so do this for that office there. If they not do I don't get for go delay complaint to the pa. So, but sometimes you go now. But to his credit, I know nobody say, oh, they're not again. No. He's giving instructions. VP Seth don't give instructions. So what do you go do?
But it's worrying when the president and the VP give instructions.
Well, no, it's competing priorities to their defense.
But I understand. But what you're doing is also important.
Yes.
It's
and I don't know what's going to happen after December.
Exactly. Because it's important to make the president appoint you and create the office. If it wasn't, he go say, no, we don't need that. We get competing priorities. But look what's in there. Look the thing where you don't say. Very important. Addiction is a mental problem. people they take and say, Bonatkanga is speaking get for the pan drugs. We don't understand, say it's a problem. And if you don't get the resources for able create awareness and do the work, train people them after December, it's a problem. We hope the money come anyway.
So,
Yes,
Labrana,
yes.
waiting, Doc, they say, the world is competing. So, we don't know what and who are within that competition tier.
And how do we prioritize the competing, issues? Because for me, health, mental health, they work harder, they do so with what you get right now. Somebody just mentioned Liberia, the government just buy 15 motoka for them. They open.
I don't get
funding.
KITF.
Oh, now you private
From
people-
April 22, I should have an official vehicle. Take today, I have a project vehicle where the project they end December.
Now you motoka carry it now. Now go office motoka carry.
And it's part of my TOR.
Now bike it.
And it's part of my TOR. I should have a vehicle. These are some of the issues,
Yeah.
Where you see me office, my office does not take 500,000 US dollars to run. It doesn't take millions of dollars to train people. I mean, I can train people for less than $200,000 a year, train 1,000 people. But you could say people, the budget's too small. But you want me to inflate a budget? No. Then we have
And the
this.
small budgets, the money no they can. Anyways.
Oh, put me back what I deck this money. I know they are travel.
No, but doc, these are the
Yes,
realities.
it is.
Like you
It's
say,
very-
the
it's
president
very-
gets all the wheel and
Yeah.
say all these things. But if you not get the resources,
It is.
if you're not a person who get passion for what you do, same as Dugba, we go hop on a bike this morning for can't talk to the public. You go say, no, I don't care. I won't go there.
Yeah.
If you don't get the passion for do this, doc, if not be any other person, you go say, no, when months done and go pay me, waiting ever then they give me, I go sit down and not do nothing. But the president can get all waiting he want for do. But if we don't provide the resources and prioritize some of these things, were important with we well-being and mental health, then
It's very, at times, I mean, this is truth media. It's demeaning. It's demeaning. Look, last 2 weeks ago, UNGA, they did a whole declaration on mental health. I submit paperwork for go UNGA. You see me there? You see me there? I ended up there because I was in America. Anyway, it's a lot. It's a lot. It's very demeaning.
I know, I understand. I understand. We pray and hope say
Yeah.
things will get better. Dugba, waiting go be your message to people out there in terms of, maybe getting the agency involved if there are issues we then see around in communities.
So, people outside there, I know, say, maybe we not see the best of what they do it, but I want to know, say, a heart for like cry for person net docly say which happen I read. At least we did try and we not get all what it takes for like we completely able for tackle. And I want to know say when once everything or half of what itself we watch for like we get. Imagine we not get a it, but we still the fet and we still the try which we beat for able for tackle the drug related problems them. We dey make arrest them, we dey help in the treatment and rehabilitation of victims them, and at the same time, we want to get the hope for say the National Drug Law Enforcement Agency, na a Cumbria agency where they are for give the support.
Okay.
Feel free for contact Lambrana and get to the agency. We office the number 2 Walpole Street. We dey as well deal with the addiction problems them. We as well do a referral pathway for help people that way they get the complications related to mental health problems.
Okay, thank you
Thank you
so
very
much, Ibrahim Samuel Dugba. I appreciate that you take your time for joining me this morning.
Yes.
And thanks for all the sacrifice you they make. Like you say, people will not understand. Go see them sometimes and think, say, no, them people are not they work. But if you not get what you for work with, imagine you know, Dugba na one old director. A bike jump and this. It was true. Dugba should have a vehicle where go take and can drop him. He doing work done, he can go to your office. Back, Doc, what the message to the public out there? We're dealing with addiction and mental health.
I would say for the public, for just understand, say, addiction not brain disease. not to 1 day, not to 2 day. When you talk about recovery, yes, somebody go through detoxification, they go come back. Duba mentioned briefly the relapse, and then also recovery is a lifelong journey. You go see somebody today, and I'll just use in America, for example, somebody today, they don't go through recovery, go through the process, they don't left for drink, smoke, or even sniff, if not cocaine, heroin, whatever. 30 years later, then go relapse. Because it's a continuous journey. Or even on my social media, I always talk about the journey continues. When you talk about addiction, mental health, not to something where somebody they can't solve today for you. I was listening the other day, so when you say, oh, if I go see a mental health professional, they solve you, problem them for you. That's not what professionals are for. It's to give you the tools to manage, because not all problems are solvable. And we have individuals, again, that are dealing with traumatic issues, that are dealing with developmental issues. One of the things that I see here in society, we paint we all as one. We all not to one.
Yeah.
Just like how we finger them different, all man in brain different. Some people have developmental issues. Some people have low IQ. So we have to factor all these different things. You have to factor the behavioral aspect that influences addiction and mental health disorders. These are some of the contributing factors where we don't even begin for touch on. So a lot of education needs to be done, a lot of training, community initiatives around what is addiction needs to be done, and we go push as long as we can.
Thank you very much. We hope the money will come before December end. Hopefully. But thank you so much, Dr. Carol Labor, in the Senior Advisor on Mental Health and the Ministry of Health, and also and Technical Lead, Mental Health Secretariat at the National Public Health Agency. And I also been get Ibrahim Samuel Dugba, the Director of Prevention, Education, and Training, National Drug Law Enforcement Agency, NDLEA. Thank you so much for joining us. If you need any help, reach out to us. We go connect to now with them people there, especially Dr. Labor, for help you if your family person or you go through any stress. We need help. We all need them, and we committed for help for pass on education and awareness on mental health and as well addiction. We all, I can say, with drugs, addiction, with sabi person or family person, with sister and picking, with brother and picking, with cousin, with friends. And somebody called me yesterday, they tell me, say, he had this friend at school. People and being difficult for people and for differentiate whether they are just friends. They were like brothers. And this person gets hooked into drugs, don't destroy him. And the guy was so sad about what's in the apple with dying party day. So that's about it. We all know communities them. Afrobarometer do a report we say 10 people, out of 10 people, every other Sierra Leonean must sabi somebody we get either drugs, mental health issue. We all connected. And if we see them here they happen, we know take action or we know seek help. But again, I have to understand who the help is. So that is what we are going to provide here. We provide with we go get in touch with Dr. Labor and the ministry, the one that we're responsible for, see how we could give people information outside for seek help and support in case they get any problem. This is the Truth Morning Devotion. We'll take a quick break. We get send the left read and we can close the program. Leon start the play today. Hopefully we go win and go World Cup. Continue for stay with we.